And we are live. Okay, cool. So let's go ahead and bring everything up. Is this it? Yes. I think. Yes, it is. Okay, cool. All right. All right. NCLEX Jeopardy. Y'all know what it is. NCLEX Jeopardy. Bring my face down. And kind of put it like right there. All right, guys. How y'all doing today? What's today? Thursday, of course. Happy Thursday. Happy Thursday. Oh, I just got really, really hot. And I have a long sleeve thing on. All right, guys. So if you are here for our weekly NCLEX Jeopardy. All right, our game style or game show style review for the NCLEX RN and PN. All right, this is our fun way. Well, it has been my fun way of just reviewing for the NCLEX, preparing yourself for the NCLEX, no matter if it's the PN or the RN. And now it really doesn't matter if it's the current NCLEX or the next gen NCLEX, but preparation is always super, super important. That is one of my main ways that I tell you guys that's the best way to prepare. All right, it's by taking practice questions. All right, practice really makes progress. Not perfect, but it really does make progress more than just reading the chapter in your textbooks over and over and over again. All right, so this is how it's gonna go. All right. If it's anyone's first time playing NCLEX Jeopardy, can you let me know? Can you comment below and let me know if it's your first time here? Let me know if this is your first time in NCLEX Jeopardy. If you've been here before, welcome back. Hey, Chloe. Chloe's a first timer. Awesome, awesome. All right, so I'm just Lachey as well. All right, so I'm just gonna give you guys a general just run overview or rundown of how we're going to play. Nurse Sumrall, also first time. Awesome. Thank y'all so much for joining me. Okay, so just like you see this in the back, you're gonna get the question. All right, I'm gonna bring up the screen that's gonna have the question and the answer choices. All right, now this review is good for just the NCLEX period, and that's whether you're taking the current NCLEX or you're taking the next generation NCLEX. Okay, same content. The strategy is going to be different, but we're going to go deeper into that as soon as we get our mid-December update to our Ultimate Nursing School bundle. But for now, we're going to definitely dive into our current NCLEX / traditional items. Okay, so you're going to see the answer. You're going to see the question and the answer choices in the back. All right, what you have to do is actually pretend you're on a game show. All right, NCLEX Jeopardy is the game. And you're going to, in the comments, answer it as a question, just as you would regular Jeopardy. Okay, so if you think that the answer is like the second option, you would type in what is 2. Okay, you don't have to type out all of what 2 is, but you just, what is 1, 2, 3, or 4, and just say what is. Okay, if you want points, because remember, we're playing for points. All right, whoever gets the most amount of points or has the most amount of points when we end, which is going to be around 8 o'clock, they're going to be the winners of this week's NCLEX Jeopardy, and they're going to win a free Ultimate Nursing School bundle. A free digital Ultimate Nursing School bundle. Okay, now retails for regularly $97. All right, that's 400 pages of fun, creative, entertaining cheat sheets and study guides for nursing school, whether RN or LPN. All right, it's everything that you need to know, just without the fluff. It's just the important stuff, and it's done in a fun and entertaining way, so it could actually grab your attention and hold your attention as well. Okay. I'm not taking either, but I've worked in healthcare for 8 years testing my knowledge. That's perfectly fine. We get a lot of people that's just here because they were scrolling and my live came up. That's perfectly fine. Thank you so much for staying and joining me. If you still want to take a jab at it and still try and play, you're totally open to. Okay, if you don't want to play for the actual prize, just don't say what is. All right, so if you want the points, if you want to participate and actually get the points for the chance to win a free digital Ultimate Nursing School bundle, then say what is. If you just want to just test your knowledge and just kind of play for fun, whether you're a nurse already, not a nurse, whatever, then just answer. Okay? I don't want to give points to, people that don't really want the points. So I wanted to make sure that whoever wins the Ultimate Nursing School bundle is somebody that actually really needs it. And we've been doing a great job in making sure that that's what happens. So thank you guys so much for that. And I just ask that continues. Okay? So remember, say what is when we answer the question, because you're answering question style, all right, Jeopardy style. Say what is if you want to qualify to get the points. Okay, now the first person that answers on my screen first with the correct answer in the correct format is going to be the winner of those points. All right, now I say that to say, okay, now sometimes there's, because it's, live and internet, all of us have different internets and speeds. If somebody answers, what's on my screen may not appear exactly in the same order as what appears on your screen, especially if people are, trying to get the same answer at the same time as fast as possible. Some people are going to show up first, some people are going to show up second, even if they did it like at the same time. So just to avoid any confusion and to keep it fair, I'm only going to go by what I see on my screen. So if Alice is before Jane, Alice is going to be the winner of those points. If it's Jane on your screen first instead of Alice, like I said, I can only go by my screen. All right. So if y'all have any other questions as we go along, that's pretty much basically the gist. If you have any other questions as we go along, just go ahead and ask. All right. This is like a half study group, half like live group tutoring. So, we go over the rationale. Any questions you may have, anything that you don't understand, just go ahead and ask. That's what this session is here for, just for practicing and answering any questions you may have that may have come up because of the question. All right, so give me a thumbs up if you guys are ready. Thumbs up if you are ready to play NCLEX Jeopardy live on TikTok. All right, give me a thumbs up if you are ready. Awesome. I'm just going to grab some of my study gummies. Did y'all grab y'all study gummies when we were in stock? Because we're out of stock now. But she may have stashed away about 10 different bottles because of a holiday giveaway that we have going on this month. So if you didn't get your bottle, make sure you stay tuned for that giveaway. All right. It is Lion's Mane study gummies. All right. I'm getting thumbs ups. So let's go ahead and start. This is my brain boost. Woo. All right. Here we go. What do you say? I grabbed some gummies. All right, let's see what our first question is going to be. Holds one. Wait for it. All right, let's do mental health for 300, actually. It's a medical coder, but I want to play. Join in. Let's see how much you know. But if you, because you're a medical coder, you're not in nursing school, unless you are, I'm not sure. Don't say what is, just so you won't get the points if you do answer it first. All right. So first question up. Mental health for 300. By the way, you do not have to wait for me to read the question. Once you read it and you know the answer, you just say what is, and then whatever the answer is if you want the points, or just answer it if you don't want the points. All right. A client experiencing disturbed thought processes believes that his food is being poisoned. Which communication technique should the nurse use to encourage the client to eat? 1. Using open-ended questions and silence. 2. Sharing personal preferences regarding food choices. 3. Documenting reasons why the client does not want to eat. Or 4. Offering opinions about the necessity of adequate nutrition. What is our answer? What is our answer? I'm seeing you guys answer. A lot of people are saying like 1. I'm seeing lots of 1s, but I'm seeing some 4s too. I see some 3s, but I'm seeing majority 1s. I would say majority of the answers are 1s, then 4s, then 3s. Nobody thinks it's 2, apparently. All right, so remember on the actual NCLEX, whether it's the current or the next gen NCLEX, you're gonna have about 75 to 145 questions on the current, and then 85 to 135 on the next gen. I'm gonna double check that. So you want to spend about 1 to 2 minutes, no more, on each question. All right. So let's see what this answer is gonna be. All right, mental health for 300. Okay, let's go. The answer is, what is one? Using open-ended questions and silence. All right, I forgot to say, a good way for you guys to prepare for the next gen NCLEX, whether you're taking it or not taking it, doesn't matter, because really within nursing school, they're still going to try to crack down on testing you, asking you better questions to test your clinical judgment. So a great way to practice doing that is to, whenever you're practicing with current NCLEX questions, ask yourself why. Okay, so all you guys that chose 1 or even chose 4, whatever answer you chose, go ahead and ask yourself why you chose it and give the reasoning, rationale, in the evidence of why you chose whatever answer you chose. Okay, all right, so this one is, like I said, what is one? It says open-ended questions and silence are strategies used to encourage clients to discuss their problems. Okay, sharing personal food preferences is not a client-centered intervention. Then it says the remaining options are not helpful to the client because they do not encourage the client to express their feelings. The nurse should not offer opinions and should encourage the client to identify the reasons for the behavior. Just like y'all got to identify the reasons for y'all answer. You get it? Okay. Remember, this is mental health. And whenever you have these types of questions, especially with mental health, and they're asking you, what's the best way to handle this patient, this particular patient, pay attention to the patient. All right. Mental health is a little different from everything else because it's not like a physical ailment. It's you sometimes you can see it, sometimes you can't. But when it comes to mental health, it's all mental. All right. So you have to choose your clinical decisions and your make sound, appropriate clinical judgment based off of that individual client themselves. Okay. All right, we understand why it was this. Let's see who got this one first. A lot of people said 1. So let's see who got this one first. What is 1? First person to say what is 1 was Just Brit 27. Awesome. Just Brit 27. Congratulations. You are the first person on my screen to answer correctly and in the correct Jeopardy format. All right. So Just Brit, congrats again. You just won 300 points. You are now on the scoreboard. All right. Couple things. If you did not answer first, but you still got the correct answer, you're winning. You're winning. Okay. That's really the purpose of this game or this review is for that specifically. Okay. Like on the actual NCLEX current and next gen, it's not going to be Jeopardy style. It's not going to be group style. So you're not going to see other people's answers. You're not going to be racing to be the first person to the finish line. It's not going to be like that on the NCLEX. All right. This is just a fun way to make it, fun with some friendly competition, some prizes, some fun, all that good stuff. Okay. But as long as you got the correct answer and you know why the answer is correct, even if you got the incorrect answer, as long as you go through the rationale and really understand why it's correct or why you got the incorrect answer, that's how you use these practice problems for your benefit. All right. It's not just mindless, just take these questions. You're actually learning from it actively. Okay. You retain more and you retain it longer when you do it that way. All right, so great job to everyone that got what is 1, and great job to Just Brit for being the first person to do so. All right, next question. All right, what's that? I'm an LPT and the true rationale is key. Period. Rationale is super key. All right, guys, next one. Let's go. By the way, if you know any other nursing student, or if you have, your cohort or class of nursing students, so they're not doing anything on this Thursday night, just go ahead and just tag them so they can go ahead and join the live. All right. All right, next one. Let's do fundies. Let's do fundamentals for 200. Fundamentals for 200. A client has just returned to a nursing unit after an above-knee amputation of the right leg. The nurse should place the client in which position? 1, prone. 2, reverse Trendelenburgs. 3, supine, with the residual limb flat on the bed. Or 4, supine, with the residual limb supported with pillows. What is our answer? What is our answer? A lot of people saying 4. A lot of people saying 4, which is supine with the residual limb supported with pillows. All right. Do I have anyone here that's going to be taking the next gen NCLEX? Is anyone here taking the NCLEX on or after April 1st, 2023? Because that means you'll be taking the next gen NCLEX. Now, with the next gen NCLEX, it's a mix of current and new NGN item types. Okay, so a lot of people are freaking out about this next gen new NCLEX, new format, and how the whole thing is going to be different, but it's really not. Of the 100 and something questions, 150, 145 questions that you're going to be taking, 18 to 25 is going to be NGN. Everything else is going to be traditional current NCLEX. Okay? If anything, some of the current questions may have more answer choices. Like instead of, you see it has 4 right here. And some of the extended new item types for the NGN, you won't have 4. You'll have somewhere between 5 and at max 10. So you'll have more options, but the basis and the cognitive thinking is still going to be the same. Okay? All right? You're going to have different variations. But if y'all want to learn more about that next gen NCLEX, download the free guide that I have that's going to give you an overview of what to expect and how to prepare. And or B, watch the replay from the live we did about a week or 2 ago, going into the differences between the current and the next gen NCLEX. All right, so let's go ahead and see what this answer is going to be. All right. What's that? How long will it be before it goes completely NGN? Well, the NGN takes effect April 1st, 2023. So after that, it's going to be next gen NCLEX. Yeah. All right. The answer to this fundamentals for 200 is what is 4? What is 4? Supine with the residual limb supported with pillows. Great job. A lot of people said 4, so congrats. Great job. Oh, wait, let me move my face. Oh, gosh, here we go. Okay, got it. All right. Before it was giving me problems. Hold on. Okay, there we go. I just want to just move it out y'all way. All right, so. So, hey, we're done with this. I'm taking English, but don't know where to study. This is our live version. If you want to play the mobile app game, then you have to download the free mobile app, which is called the Nurse Sam. NCLEX Jeopardy, the mobile version is only exclusive to the Nurse Sam app. All right, so you can go ahead and download that if you want to play the full 25 questions. All right, so let's go ahead and get into this. Who got this one first? Hold on. This is 4, 4, 4, 4, 4. Hold on. Wait for it. I'm going back to see who got it. All right. Life of LMA. Wait, no, sorry. It was actually Ray B. Tant. Well, nope, actually. It was actually Kendall V12. All right, Kendall V12 was the first person to get 4 and say what is 4. Remember, if you don't want to get the points, you just don't say what is. So if I just see you say 4 or just see you say a number and not the what is format, that's just going to signal to me that you don't want the points, which is fine. You're just here for the review. but then I'm going to give the points to someone that did use the correct format. All right. And first person on my screen, okay, on my screen is Kendall V12. All right. So congrats, Kendall V12. You got 200 points. Awesome. Awesome. Let me scroll down to see what y'all are saying. Yeah, I was going to say your name. I was in the middle of saying your name, but you didn't say what is. Remember, for anyone that's just coming in, if you want these points, you have to say what is. Okay? All right. Awesome. Perfect. Great job to everyone that got it right. So let's go through it. It says the residual limb is usually supported on pillows for the first 24 hours after surgery to promote venous return and decrease edema. All right. After the first 24 hours, the residual limb usually is placed flat on the bed to reduce hip contracture. All right. Edema also is controlled by limb wrapping techniques. All right. In addition, it is important to check the primary healthcare providers or the surgeon's prescriptions regarding positioning after amputation, because there are often differences in the preference in terms of positioning after the procedure related to risk associated with hip and knee contracture. All right. So generally, you have what you're supposed to do, 24 hours within the first 24 hours and then after the first 24 hours. But if the surgeon or the provider has specific instructions on positioning, then you go with that. Okay. All right. So let me see what y'all was saying. First on mine. I think that person actually said 4 from the other one. I hadn't changed it yet. So the first person to say the correct answer after I changed it and say what is was Kendall. All right. Someone said, what is the point? Wait, what's the point? Is there some type of prize or is it just for fun? Both. All right. So the point is for you guys to review. All right. This is a free practice, NCLEX style practice. 2, we are also playing for a prize. All right. Whoever gets the most points at the end of this game is going to win a free digital Ultimate Nursing School bundle. Okay. That is regularly $97, and you're going to get it for free, whoever wins. All right. Can you take this while you're still in school? No, you have to graduate. All right. Any questions with that one? Quick little not study strategy, but test taking strategy. I'm not sure how this will really work on the next gen. It won't be as easy because they won't have just 4 options, but for tests and exams specifically, either your nursing school exams or the NCLEX, the current one that has 4 multiple choice options, whenever you have, let's go back to it just so you can kind of see what I'm referring to. Whenever you have questions, answer choices like this, like I said, 1 through 4, whenever you have 2 of the 4 that are either similar or the opposite, pay attention, okay? Because if it's similar and they're both saying the same thing, you have 2 options where you're only supposed to be choosing one correct answer and 2 of them say the same thing, then more than likely it's not going to be those 2. All right? Now, if you have, once again, a multiple choice answer, you're only supposed to select one correct answer, and you have 2 answers that are opposite, or have an element, just one element of the 2 that's opposite or different from the other. For example, 3 and 4. They're both supine, and just one has a residual limb flat on the bed, and the other one has the limb supported with pillows. So it's either going to be flat on the bed or on pillows. That's opposite. More than likely, according to test taking strategies, one of those 2 is going to be the correct answer. All right. Whenever you have opposites, pay attention to those 2. Because more than likely, like I said, one of those will be the correct answer. Okay? All right. Next question. Is an order to win? It'd be a nursing student, yes, because this is a nursing student study guide. So you either have to be currently in nursing school or like a new grad that's preparing for the NCLEX. Okay. All right, let's go to our next question, guys. Oh, that was the answer. All right, next question. We have pharmacology for 400. Pharmacology for 100. We said the answer was 4. We were just going back so I can show y'all something about the actual answer options. This is the next question. Pharmacology for 400. All right. Somebody said, is this for LPN or RN? It is for both. Okay. The stuff that's that you're learning, the content that you are learning in the education within nursing school, whether it's for RN or LPN, what's going to be tested on the NCLEX, it's very, very similar. Very similar, y'all. We have to learn, I'm not gonna say the exact same thing, but basically the exact same thing. All right. So this is stuff that nurses need to know in general, whether you're RN or LPN, gonna be bedside or whatever. The NCLEX doesn't know that. All right. They don't know what you're about to be. So they just want to make sure that you are competent enough to keep your patients safe. And these questions and a lot of the NCLEX style questions for RN and PN, there's very little difference between the two. Very little difference. And that's from someone that has viewed almost every NCLEX book you can think just because of my business for RN and LPN. All right, now let's get into this pharmacology for 400. All right, atenolol. Atenolol has been prescribed for a client, and the client asked the nurse about the action of the mechanism. I'm sorry, what? The action of the medication. How should the nurse respond regarding the action of this medication? 1, slows the heart rate. 2, increases cardiac output. 3, increases myocardial oxygen demand. Or 4, maintains the blood pressure at a level within the 140/90 millimeters of mercury range. All right. How should the nurse respond regarding the action of this medication? This medication being atenolol. What is our answer? What is our answer? What is our answer? All right. Remember to say what is if you want the points. If you just here for the review and you don't want the points, then you can just answer. But if you want the points and want to qualify for the points, you have to say what is. You have to be the first person to say what is and then the correct answer on my screen. Okay. All right. Let's see what our answer. Well, I'm going to give y'all like another minute. All right. What are y'all saying? The answer is. Wait, how did I scroll all the way down here first? All right, remember what I said about knowing your rationale, knowing your why. So everyone that answered, that already submitted your answer, go right back to your little keyboards and tell me why. Why did you choose that answer? Why is that the correct answer? Okay, defend your answer. Why did you choose whatever you chose? What is your rationale? So what is your name? I'm Nurse Sam. Hello, I'm Nurse Sam. Wait, I'm scrolling all the way up. All right. Let's go ahead and look and see what that answer is. While y'all are telling me why, y'all got y'all answers, I'm gonna go ahead and bring up the correct answer so I can choose who got these points on my screen. All right, let me see what y'all are saying. Someone said, 1, because it's a beta blocker and it lowers BP, it also lowers heart rate, slows heart rate and BP. And then the beta blockers are used to reduce cardiac output. This will decrease the BP or the blood pressure. All right, so let's look and see what that answer is. All right, so the first things first, I would identify what classification of medication this, the one that they gave us, belongs to. All right. Pharmacology tip. All right. Whenever, let's go ahead and get into it first. Boom. That's the answer. What is one? But whenever you have a pharmacology question and they give you like a medication name and you're studying for it, learning it, whatever, make sure you're studying / attempting to learn the classification rather than the individual medications. All right. So instead of, learning the mechanism of action, side effects, contraindications of each and every type of beta blocker and store that in your mind, know that for beta blockers as a whole, like that classification as a whole. Because more than likely, if it's a part of that classification, they're all going to have the same parameters, give or take, depending on, certain things. Some meds are more tolerable than others. So they may have different, like a couple of different considerations, but anything that's of importance, you'll know about. Okay. So for atenolol, once again, this is atenolol is our beta blocker. All right. Quick little hints. Whenever you see a drug name and the suffix is OLOL. All right. And this is not social media. This is not Twitter. We're not LOLing, LMAOing. No, OLOL at the end of a medication name. That's your hint. That's your suffix hint that this is a beta blocker, beta adrenergic blocker receptor. And in beta adrenergic blockers, it's used as an antihypertensive, which means it's used to reduce blood pressure when it's high, anti-anginal, which is anti-chest pain, and anti-dysrhythmic. So any type of dysrhythmias, cardiac dysrhythmias, it's used for that as well. All right. So this is the mechanism of action for a beta blocker. All right. It blocks beta adrenergic receptors in cardiac tissue and produces the therapeutic effects of slowing the heart rate, decreasing cardiac output, decreasing myocardial oxygen demand, and decreasing blood pressure. Okay. All right, so our beta blockers, it's gonna block them betas. We blocking betas. Y'all remember Stomp the Yard? Betas. But yeah, that's what I'm gonna think about. But yes, if it's slowing the heart rate, that means it's slowing the movement of blood throughout the heart. Okay, now if the movement of blood throughout the heart is going at a slower pace than usual, then you can expect for that blood pressure to also be decreased. And you can expect for that cardiac output to also be decreased. Okay, you have think of it as you have less traffic, you have less foot traffic going through the heart. All right. If you're slowing that down, you're gonna have decreased output as well. And then if you have decreased cardiac output, all right, there's not enough oxygen. I'm not saying there's not enough. But if you have decreased cardiac output, that means all the oxygen that's in that blood is taking a slower time or a longer time to get to the different things, including your heart, that it needs in order to actually survive and take up that oxygen demand. So if you're going slow with the oxygen, hello, your body's going to feel it. So beta blockers, it decreases all that. Heart rate, BP, cardiac output, and myocardial oxygen demand. Okay. Meet me at the mall. It's going down. That's funny. All right. Okay, perfect. All right, first person to get that answer was Kristen Gullett. Kristen Gullett, congratulations. You're the first person to say what is one. So you are the receiver of those 400 points. So now you are on the scoreboard with those 400 points. All right, so quick little overview of the scoreboard. All right, we have Kristen, who just came in, guns blazing, 400 points in the lead. Then we have Just Britt with 300 points, and then Kendall with 200. All right, what time is it? All right, we still have about 20 minutes. All right, so it can be anyone's game. Let's go ahead and continue on. Give me a thumbs up if you're ready for the next question. Next question. All right. I'm going to say you're ready for this. Oh, thank you. Thank you. Thank you. All right. You ready? Okay, cool. Next question. Let's do, what's this? Ooh, maternity for 400. Ooh, I see GT Pal. Let's go ahead and get into it. All right. The nurse, this is maternity for 400, guys. The nurse is collecting data during admission assessment of a client who is pregnant with twins. The client has a healthy 5-year-old child who was delivered at 38 weeks and tells the nurse that she does not have any history or does not have a history of any type of abortion or fetal demise / miscarriage. Okay. Using GT Pal, all right, what should the nurse document in the client's chart? All right, you have 4 options here. All right, they each give you a different GTPA and L number. All right. So what is our correct GT-PAL of this specific client using this clinical scenario that they gave us? All right. I'm seeing 1s, 2s, 4s. All right, 1 says that the, we'll go through it. We'll go through it. I'm gonna let y'all just answer it, and then we're gonna go through it just in case you struggle with this a little bit. We're gonna go through it together. All right. Y'all are saying what is 2? I'm saying lots of what is 2s. But I am seeing some like 3. I'm saying 1, 2, 3, 4. I'm saying majority 4s, but I'm seeing a little bit of everything. All right. Remember, if you want the points, say what is. This is NCLEX Jeopardy style. So you have to answer in the form of a question. You have to say what is if you want the points. Okay. If you don't want the points and you just want to just be here for the review, like do you comprehend or do you not type stuff, it's perfectly fine. Just don't say what is. Okay. All right. So, all right, let's look and see what that answer is because I'm getting a little bit of everything. So let's walk through. If you guys have the, well, I'm pulling up the answer. If you guys have the Ultimate Nursing School Bundle or the maternity study kits, there's a GT Pal worksheet in there to help you out, to help you learn how to do GT Pals. I'm trying to see if I have it with right here printed out. 1 second. I might not. Do I? If not, I'll just attach a picture of it because I don't see it. That's fine. That's fine. All right, so let's see what that answer is. GT Pal. All right, and our answer is what is 2? The answer is what is 2? How y'all feeling? Did you get the correct answer? Did you get the correct answer? All right, so I'm going to scroll and see who got what is 2 absolutely first. Saying what is. Let's see. All right, let's go ahead and see who got what is 2 first. Tanya. If I'm butchering your name, please let me know. But the only thing I kind of recognize is Tanya. So Tanya. Tardy is Tanya? I'm not sure. But yes, congratulations. You are the winner. You're the first person to say what is 2. Well, you say what is 2, but it's fine. I'm totally just kidding with you. But yes, you got 400 points. So now you, Tanya, you're tied with Kristen with 400 points. All right. Now, for all you guys that got 2, whether it was what is 2 or just 2, great job. Especially if you didn't guess or just go along with what you saw. If you really, went through the answer and comprehended it, understood it, was able to get that correct answer, snaps to you. Great job. Great job. If you did not get this correct, it's okay. That's why we go over rationales. That's why we have rationales. All right. I don't know about y'all, but I don't like getting got twice. So once I do something wrong, or once, I get something wrong, I'm going to pay attention to it so that it doesn't happen again. Fool me once, but not fool me twice. Absolutely not. All right. So GT Pal. All right. The answer was G was 2, T was 1, P was 0, A was 0, and L was 1. Okay, so what is GT Pal? I'm not sure if you guys have gotten into maternity yet. If not, then that would make sense as to why you didn't know this answer. But now you've been exposed to it, so that when you do take maternity, you won't be that much of a stranger. All right, it won't be that much of a shell shock. Okay, so GT Pal describes pregnancy outcomes in those clients. All right, and it's basically like the maternal and obstetric history. Okay, so this is what GT Pal stands for. G stands for the gravidity. All right, and that's the number of pregnancies. T is term births, the number of term births. So any births that were longer, or any births after 37 weeks of gestation, that would be a T. P would be preterm births. So that's any births before 37 weeks of gestation. A would be abortions or miscarriages, okay? The thing with abortions or miscarriages can also be called spontaneous abortions, okay? Sometimes it's also called like fetal demise, whether it's like elective or non-elective, okay? Now, it says it's included in the gravida, which is the G, if the abortion or miscarriage occurred before 20 weeks, which is the, what's it called? Viability. It's the period of viability. I forgot what it's called. Something about viability. And then it says it's included, that number is included in the parity, or the number of births, just period, /T, if it's past 20 weeks. All right, so if it's past that, what is that called? Because now it's going to bother me. What is that called? Something. It's past this final answer. Oh, awesome. Looking at what y'all are saying. Gravida is number of pregnancies, right? And then the parity is the number of births, which is different than the number of pregnancy. That's why I said the parity, aka the number of births, that would include if it's term or preterm. So really that can, it depends on, once again, if it's 37 weeks / also if it's before or after, after 20 weeks, past that viability. And then L is the number of current living children. All right. So the names or the letters, it helps you remember what it's actually measuring. All right. G for gravidity, T for term, P for preterm, A for abortions, L for living. Okay. Now let's get into this specific patient. It says a woman who is pregnant with twins. So she is actively pregnant with twins. All right, this is what I do. I write GTPAL on a piece of paper, and then I go through the clinical scenario and fill it in. I just fill in the blanks. All right, so we have, once again, let me move my head. All right, a woman who is pregnant with twins and has a child has a gravida or G of 2. All right, so remember, G, gravity, is the number of pregnancies. She's currently pregnant now, and she also has another child, so that gravida is going to be 2. Now, it's very important to note that even though she's pregnant with twins, it's still one pregnancy. She'll be giving birth twice, but the gravida is still under one pregnancy. So make sure you kind of know that. All right. Now it says that because the child was delivered at 38 weeks, they told you all this in the clinical scenario. Because the child was delivered at 38 weeks, it's considered a full term birth. So the number of T would be 1. Okay. P would be for preterms. The number of preterms is 0. They let us know that. The number of abortions / miscarriage is 0. So A and P, or P and A, will both be 0. And then as far as the number of living children, remember, she's still actively pregnant with those twins, so they have not been born yet, so they're not living outside the body. And then she has, I think, that 5-year-old child or something like that that's living. So she has 1 living child. So 21001, which would be number 2. Make sense? Makes sense. So I get confused with the abortions part. Does it take away from the gravida? That's why it says it right here. It is included in the number of gravida if it's before 20 weeks, and it's included in the parity, which is the number of births, if it's past 20 weeks. So that's why that's included in there. Okay, so it all depends on if that pregnancy is viable, as far as if it's a part, the abortions are a part or not a part of the gravida. Let me see what y'all saying. My mom gives birth to the twins. That would mean her GT-PAL would be G0. No, because remember, she still had those pregnancies. The G will still be 2. She still had those pregnancies. She's just no longer, when she gives birth, she's just no longer pregnant. But she still went through pregnancy twice. All right. Not for the 2 twins, but for that first child, the 5-year-old, and then now the pregnancy for the twins. So that G would still be 2. As far as the T2, according to you, if she gives birth to the twins, did they say how far along she was with the twins? Because if she delivers in their term, I don't know if they told us that, but if she delivers in their term, then an additional 2 would be added to the term births. If they were delivered prematurely, preterm, before 37 weeks, P would now be 2. And 2 would just be that 1. Okay? Remember, she still had that 1 kid. So anything as far as the births, assuming, a star of the births, you would add 2 to whatever's already pre-existing, if we're following your example of what would happen if the mother gave birth to the twins. Does that make sense? Okay, cool. No, I'm saying twins would be considered 1 pregnancy, but we were talking about births. All right. Even though she's pregnant once with those twins, she still has to give birth to each twin. All right. So it's twins are 1 pregnancy, but 2 births. 1 pregnancy, 2 births. There's a difference. So make sure y'all know that. Okay. And just kind of just think about that. All right. We got that one. We're cool on this one. Awesome. Like I said, remember, if you need, we have that GT-PAL worksheet if you want to continue to practice. Now let's go to our next question. Pediatrics for 400. Pediatrics for 400. Right. Perfect. Halloween said, would the abortion and miscarriage be in preterm births after 20 weeks? Yes. If it's after 20 weeks, yet still of viability, the gestation. If it's after 20 weeks, yet before 37, then it would be preterm. All right, now back to this one. Pediatrics, 400. A 7-year-old child is seen in the clinic, and the primary healthcare provider documents a diagnosis of primary nocturnal enuresis. The nurse should provide which information to the parents? 1. Primary nocturnal enuresis does not respond to treatment. 2. Primary nocturnal enuresis is caused by a psychiatric problem. 3. Primary nocturnal enuresis requires surgical intervention to improve the problem. Or 4. Primary nocturnal enuresis is usually outgrown without therapeutic intervention. What is our answer? Okay. Remember to tell me why. Tell me why. So I don't know how y'all type it so fast. I even have my what is ready in the messages. Yeah, that was going to be my little slick little hack. Make sure you like copy and paste what is so that when you're ready to just answer, you just click paste and then put whatever 1, 2, 3, or 4. Okay. A lot of people say 4. Like a lot of people, literally everybody except for one, everyone says 4. Yes, I said they read fast. They read fast. That was gonna be my next question. What is nocturnal enuresis? What is nocturnal enuresis? And Keisha, or Keishu, I'm not sure how to pronounce your name, just answered us. Nighttime bedwetting. All right. So wetting the bed during the nighttime, nocturnal hours. All right. What's this? Peds for 400? Yes. All right, let's see what that answer is. Remember to tell me your why. Okay. Now that we know what nocturnal enuresis is, why did you choose? All y'all pretty much chose 4. So tell me why y'all chose 4. Feisty Finance said nocturnal equals night. It seems like it's something a growing child would outgrow. The other one's just not. It's normal and normal for her, but totally normal. Okay, let's go ahead and see what our answer is. What is 4? The answer is what is 4. Awesome job. Let me see who got this one first. Wait for it. Wait for it. Okay, Kristen. All right, so Kristen, you're already on the scoreboard with 400 points. You just answered first and correctly with this question, so you now have 800 points. Awesome job. All right, so yes, great job to everyone that got what is 4 or just got 4. Like I said, as long as you get the correct answer, it means you're comprehending the content, and you're doing great, sweetie. All right, you're on the right path. All right. Here's our rationale. Okay, so just in case you did not get 4, there were some people at the end that got 2s. We're going to go over why the answer is what it is and why the other ones were not, like the actual evidence-based answer. Okay, it says primary nocturnal enuresis occurs in a child who has never been dry at night for extended periods. All right. The condition is common in children, and most children eventually outgrow bedwetting without therapeutic intervention. It says the child is unable to sense a full bladder and does not awaken to void. The child may have delayed, I was like, where'd I go? I'm down there. The child may have delayed maturation of the central nervous system. The condition is not caused by a psychiatric problem. So once again, the answer is it's common in children, and most children eventually just outgrow it without any type of therapeutic intervention. Okay. These are all NCLEX style questions. These questions have helped, I can't even tell you, thousands of people on their NCLEX, whether it's RN or LPN, exit HESI. These are NCLEX style questions. So this is the type of this is a type of format and the type of questions you can expect to see. Okay. Good job, everybody. Awesome job. 10 years since I had residence up until teens. I'm looking through what y'all saying. Awesome job, guys. All right, now let's see if we have any more. Did I find one? Yep, that was our last one for tonight, and it's 8:02. Perfect timing. All right, so thank y'all so much for joining me for this week's NCLEX Jeopardy. If you guys want to play the full 25 questions, we just played, I think, about like 5 or 6 questions. But if y'all want to play the rest of the 25 questions, you just have to download the NurseSam app. All right, it's a link in my bio. Okay, the link is also on my website, thenursesam.com. But if you go to the link in my bio, click where it says download the app so you can play weekly NCLEX Jeopardy and ATITs questions. You get 25 questions every week. All right, even though on live we go through about like 5 just because, I want to do it together. But you still have access, or you have the ability to access the full game, all 25 questions. All right, 5 questions per category, and there's 5 categories. All right, so yes, the Nurse Sam app. You can search your iOS and Android, Apple Play stores for the app, or you can just go to the link in my bio so you can download it. It's free to download and it's free to play. All right, just hit where it says NCLEX Jeopardy under NCLEX Prep when you open the app, and there you go. Okay, now the questions you have are still from last week, so I'm actually going to go and change the questions now. I'm going to go into my other app for a second, and then I'm going to change the questions over so I can go ahead and get that full experience, so you can have anytime, anywhere, NCLEX style questions that you can, 25 of them that you can practice, like I said, anytime, anywhere. For repeated exposure, it's going to help you retain more information, comprehend it faster, and remember it longer. Okay. All right. So thank y'all so much. Winner of today's NCLEX Jeopardy and the winner of the 400-page digital Ultimate Nursing School Bundle, our best seller, is Christine Gullitz with 800 points. Congratulations. Great job. Great job. All right. So Kristen, if you do not have the Ultimate Nursing School Bundle yet, and you are accepting your prize, please DM me. I hope you have Instagram. Please DM me on Instagram because TikTok's DMs are weird. It includes your first name and last name and your email address, a good email address, so I can send you your digital copy of the Ultimate Nursing School Bundle. All right. Remember, it's filled with everything that you need to know, no matter what nursing credentials you have, whether it's RN or LPN. This is all the stuff that you need to know in order to pass the NCLEX. All right. I have 2.5 years and thousands of students that can back me and say, yes, NCLEX Jeopardy has definitely helped. It's definitely worked. Why? Because you're practicing NCLEX style problems, so that when it's time for you to actually take the NCLEX, it's not much of a shell shock. All right. You're used to it. That's why the repeated exposure is very important, which is why we do these Jeopardies, either live or just the mobile version, or sometimes both, at least once a week. Okay. Let me see what y'all are saying. Bondi, can I get a prayer, please? Taking NCLEX tomorrow. Oh my gosh, Bondi, if you are taking NCLEX tomorrow, why are you studying the night before? You're supposed to be getting a massage, watching a movie. I don't know what else, but I totally understand. Good luck to you. I am sending all the prayers up. I know you're going to beast it. Okay, I fully expect you 2 days from now to hit me and be like, oh my God, Sam, I passed. I got it. So I can't wait. I'm gonna have my preset response already. Say congratulations, Bonzi, Pamlan. Congratulations. I knew you would pass it. So make sure you update me. All right, keep me updated. All of you, please keep me updated on when you're taking your NCLEX. I love to know that, these lives and my products are helping and have helped you individually. I love success stories. Okay, so make sure you keep me updated, and good luck to you again, Bondi. Anyone that is taking their NCLEX, good luck to you. Good luck to you. Good luck to you. You got this. All right. Let me see what y'all are saying. Esther. All right. Good luck to you, Esther. I can't wait for you to let me know that you passed. All right. Esther's about to be Esther RN or LPN. I'm not sure. But Nurse Esther is about to be in the house. Give her about 2-3 days. All right. But you got this, boo. All right, guys. Thank y'all so much. Kristen, I got you. Perfect. All right. Wait, is the app what? The app is free. Absolutely. The app is free. All right, guys. If you want to watch any news on the NGN syndicate, yeah, well, the same, the same news. It's coming mid-December. It's coming mid-December, both individually and also as an update to the Ultimate Nursing School Bundle. So if you already have the Ultimate Nursing School Bundle, or what's today? So in a week, so next week, the Next Generation NCLEX Study Kit, the add-on will be released and launched, and it'll also be updated to our Ultimate Bundle and also launched individually for anyone that may want to have more insight on what to expect, how to prepare, the different NGN types, practice problems, how to pass the NGN, how to score correctly, all this stuff. It's going to be laid out for you within the within that study kit. What am I doing? What am I doing? Okay, go back here. All right, guys, thank y'all so much, and I will see y'all next week, Thursday, for our next round of NCLEX Jeopardy questions. And either that day or it's the day after, like that, either that Thursday or that Friday will be the release of NGN. So can't wait for that as well. All right, guys, if y'all have any questions, please do not hesitate to hit me up. All right, send me an email. Good luck to everyone. Thank you, Nurse K. It's at 71% even after passing, right? It's fun. It's super fun. All right, guys, I'm gonna go eat. Y'all have a great night. Have a good one.